My name is Patty Helferstay. I'm a physician assistant with Gynecologic. I've always had an interest in working in medicine since a really young age. When I was in college, I was kind of deciding med school, what's next, and I've learned about being a physician assistant and really just couldn't get the job and what entailed and the benefits, knowing I wanted to get married and have kids and the flexibility that doing that would afford me. So once I learned about it, I really just couldn't get out of my head, and it just was the perfect fit. So I recently just started Oncology in the last year, but I really have always had an interest in women's health. I started my career in women's health for the first 7 years before coming here, and I really have an interest in surgery. And I always was interested in oncology, but never found the right spot. And coming here with Oncology, the team here is fantastic, and it kind of combined two things that I really care about, and sticking with women's health, but entering into more of that oncology space has been really great. I think the biggest part, most important part of a patient-provider relationship is trust, and making patients feel comfortable and understood, and that they're part of the team, that they have a say in what happens to them and how their care progresses, and what ultimately they drive the ship, so to speak, and we help guide them along we're their navigation system, right? But they're the one at the wheel kind of guiding the way. So I think as providers, our job is to lead them, but patients are the ones that have to be engaged in their care. So I think as a provider and working with patients, that's how I view my role. My philosophy of care is looking at the whole person, not just say your endometrial cancer or cervical cancer or uterine cancer that we take care for you for, but the whole picture, you know, your social health, your support system. And I think at Luminis we have great resources, and we're able to help provide that, which is why I feel this is just a great place to be. I love working with patients. My role as a surgical PA, I love operating, but I also really enjoy building those relationships, helping guide patients through what's often a really scary time for them. Surgery, when you're not familiar with it and when you're losing some of that control, can be really challenging to approach. So being able to provide that gives me a really good sense of pride in what I do, and like I'm actually helping people.